The man, the myth, the legend is back. It is our friend, Dr. Marc Cromie with the Chattanooga Allergy Clinic. Dr. Cromie,
thanks for having us. It's good to be home. It's good to be home.
Always a pleasure having you here. Getting into that season, and you and I were talking during the break, you call it perils of the patio,
yes,
right?
Sir. Yes, sir.
Fill me in.
Well, right now, the pollen is gone, okay? So people are excited. So they think that, you know, there's no danger.
Wrong again.
Wrong again, my friends, because guess what? You're outside, you're having food, you're having barbecues, so there's food allergies involved. Kids that are going off to camps have food allergies. But the other thing is, this is the time of year where people are going to have anaphylactic reactions to insect stings called Hymenoptera, yellow jackets, hornets, wasps, honeybees, fire ants. Those critters now can cause anaphylaxis, and we can allergy test you, find out what you're allergic to, and there are allergy shots that can prevent death and comorbidities from these things.
I have declared war on the ants at our house.
The ants are bad. They're making their way here.
It's amazing that you can get an allergy shot that will protect you from all of that with a syringe so small and a needle that's even tinier.
Chip, this is the similar needle to the insulin shot. So anybody that's used to giving themselves little injections, it's tiny, it's subcutaneous. It means it goes under the skin, but not in the muscle. So it's not like the flu shot, which is 1.5 inches long. This is teeny, it's a 1/4 inch, barely goes under the skin. It injects a teeny bit of what you're allergic to, dog, cat, dust mite, pollen, or venoms like yellow jackets, hornets, and wasps. And that can change the game.
And you can pack a lot of medicine, a lot of allergy protection into something this small.
That's
outstanding,
right. And it's game changer. It changes the course of your disease. Why take medicines forever when you can do something that can change it? And that's what allergy shots do.
All right, you have brought an EpiPen along.
Yes, this is the time of year where kids need to have their EpiPens when they're off at camps, or if they're just in general, if you have food allergies. But we have another game changer.
Yes.
Okay? It's called Neffy, and it is the first FDA-approved nasal spray.
Let's hop back to this here for just a second on the EpiPen, and this is a demo EpiPen. It's quick and easy. All you have to do is take it out of the protective cover.
That's right.
And then what do you do?
All right, so there's 2 steps to this, and this is what can be a problem for some people. You got to remove the needle side and you remove the back side, okay? And then you hold it like in your fist, and you will stab it into your leg. It goes through the clothes.
Why your leg?
Now, that's a great question. Years ago, we injected it in the arm. But now we found that the bigger the muscle, like your quad, the greater the blood flow and the quicker it gets absorbed.
Very good.
So it's faster acting if it goes in a big muscle. So we like to do it into the thigh.
And the actual EpiPens, I don't know if this one does it or not, it talks you through the process.
Well, there are 2. The one you're talking about is the AviQ. It's a little square one and actually speaks to you. So you can do it if you're blind, if you're, it's great for elderly parents taking care of their grandkids. So, but guess what? People get tired of needles. They're either afraid to use them or these things denature. Like if you've got kids playing summer sports, you got to keep it cool. All that is a pain. Now we have the first FDA-approved nasal spray for allergies, which is an epinephrine nasal spray called Neffy.
Now tell me how this works.
This is easy. You use it just like you would a nose spray. You spray it in the nose, one spray in one nostril, and that's all you need. Okay?
Don't have to hit both sides.
No, it's just one spray is what you need.
And this does not have the medicine?
No, that's but that's exactly what they look like. Here's another
delivery system.
They come in a cute little carrying case that's lightweight. Here's the nice thing about this, Chip. This lasts 2 years in heat.
Wow.
And so we're finding now that kids are tired of carrying around these giant EpiPens. This looks tiny. Plus, parents are happy with the fact that these things last 2 years, and you can carry it on your book bag or in your lacrosse, bag or your baseball sack. Things that aren't going to have to be refrigerated.
I know it's difficult to say immediate relief, but I would think this is as pretty close to immediate as you can get.
They say that on average, this is more effective than the shot because of the rapid absorption, the nasal mucosa. There's so much blood flow in the nose, it gets absorbed quickly.
Amazing. And even something, you got to obviously have the allergy testing to find out what you are allergic to. Even that process, you all have condensed
the time. Quick and easy, baby. Within 15 minutes, you'll find out what you're sensitive to with little scratches on the back, okay? So it's a great thing. You're in and out typically in a couple hours after I do the history. We may do breathing tests to see if you have asthma. We can even do oral challenges if you're allergic to foods that you think you've grown out of. We'll do the blood testing, find out you're no longer allergic, give you the food in the office. We're also doing penicillin testing. People think they're allergic to penicillin. 90% of them are no longer allergic.
Wow.
So that's a game changer.
Quite frankly, if you have allergies, you know how aggravating they can be, and also, quite frankly, why would you go anyplace else? Dr. Marc Cromie, Chattanooga Allergy
8 offices
Clinic.
to serve you, baby, from the womb to the tomb.
Probably going to be more if I know the way you're going. Check them out, ChattanoogaAllergyClinic.com, ChattanoogaAllergyClinic.com. We're back with more after this.